and it's wonderful to see so many of you back again with us today. A couple of housekeeping issues before I introduce our speaker. So please feel free to introduce yourself in the chat function at the bottom of the screen. Also, if you have questions for our speaker as we go along, please put them in the Q&A box. I will monitor this for questions, and we will take time at the end to answer any questions that come up. We are recording this session, as you just heard when you checked in, and it will be accessible on the Canvas site after the presentation today. Additionally, Gurpreet has agreed to share her slides with us at the end of the presentation. And finally, a certificate of attendance will be presented at the end. You need to attend the entire session to receive the certificate of attendance and complete the evaluation form that will be sent after the event. I will also put this link in the chat so that you have it handy, and then you'll be able to print your certificate following the presentation. So I will stop sharing. And now it's my pleasure to introduce Gurpreet Rana, who many of you know. Gurpreet established and leads the Taubman Health Science Library's Global Health Program at the University of Michigan. The library's Global Health Program works toward eliminating health inequities through the power of information. As the Global Health Coordinator, Preet's activities include building research capacity through evidence-based information skills instruction at University of Michigan and abroad, curation of global health data sources, participation in global health literature, exploring the role of the health informationist in global health, and building and promoting and fostering relationships with our international partners. Preet is an experienced instructor and teaches in health equity curricula and programs within the University of Michigan. She has a Master's of Library and Information Science from the University of Western Ontario in London, Canada. Please join me in welcoming Gurpreet.
Thank you so much, Dr. Laurie. It is such a pleasure to be here. Again, this is a community, the Global Sexual Reproductive Health Institute community that I feel very strongly about being a part of, and that I hope that we continue to have opportunities for learning such as this. And thank you so much for your enthusiasm in joining us today in your various time zones. So thank you. So what I'm going to do is feel free to add comments to the chat. We may stop and I may ask you questions. I don't want to be the only one doing all the work. And another thing is that we're just taking a snapshot and a look into a few selected information sources. Of course, this is not an all-day workshop. I hope that someday that we can make that happen, but today it's going to be just a look at some of the tools that I feel might be useful to you at this time. And there's so many out there, so we'll talk about that as well. So my name is Gurpreet Rana, and just as I have done at our Global Institute in May, I'd like to not only talk to you about, I'm calling this Information Empowerment Continued, because I think that as we add information tools to our toolkit as researchers in maternal, child health, sexual and reproductive health, we are empowering ourselves, but we're also empowering the communities for which we are doing the research and the work. And I'm using the we, but it is in truth that you are the ones that are doing all these wonderful activities towards alleviating inequity in health. So as I did in May, I'm going to welcome you in both English, which is one of my first languages, and my other first language being a woman of Punjabi and Kashmiri heritage and a Sikh Canadian, and that is Ji Aayan Nu. So this is in Punjabi, and I welcome you in the language of my heritage as well, as I know that so many of you have other languages that you also interact in as well. So this might seem familiar. I'm going to go through some information slides that we saw in May, for those of you who joined us for the Global Institute in May of 2021, with a future institute coming up in 2022 as well. Now, this slide is thinking about where we are in our information environment. And we often think, oh, well, there's just one great source of information or data or statistical information, and we're going to stick to it. But the truth is that we do need to really broaden our horizons when we're looking at different tools, but that can get kind of messy, and it can start to look like this. It's a very disorganized way for us to consider our tools. And these symbols are representative of tools that I use on a regular basis. And I know that many of you use some of these as well, such as the DHS, Think Global Health, Equist when looking at maternal child data. So, but this is all disorganized. How do we organize these in our minds and think about the different categories of information sources that we have available to us? And again, these are all freely available sources as well. Another thing just to give you a reminder of is our evidence-based process. Now, of course, there's quite a lot involved in conducting our research cycle, but one of the key points is to really understand what is it that you are asking when you are delving into either the literature or when you're delving into a data source. What is your question? And once we develop that concept and are sure about in that moment, what is our question? I'm not talking about a two-page, looking at 2 pages of a protocol or a dissertation, but in that moment, what is the question that we are asking? And very often that helps us identify our information resource. So for instance, I like to organize my resources, or the way I think, very often using the global goals, the Sustainable Development Goals. And that's why you see them here, the icons representing them here in the background. So when I think about gender equality, I think about using particular sources for women's health issues, such as the Global Library of Women's Medicine, for instance, which we can take a look at in a moment. Or if I'm looking at good health and well-being, I definitely may go into the data sources for the global burden of disease. So I've organized these in my mind in a certain way. And I kind of like to think of how the interconnectivity of the work of reproductive health connects to all of these areas of the Sustainable Development Goals. But again, the bottom line is matching our information need to our information resource, or vice versa. But it's very important for us to understand, what are we asking? Now, you might think that's a simple exercise, but sometimes if we don't actually write it down or think it out in a very systematic manner, we're not quite sure where to go to find that information. Today, our focus is going to be, again, on openly available free data and statistical sources for sexual and reproductive health for trusted information sources. And by the way, I'm looking away from you for a few moments because I'm working off of 2 screens. So my attention is completely on you, but my camera is on my other screen. So the one thing I do want to do is take you through a review and maybe an introduction for some of you of our Global Sexual and Reproductive Health Research Guide, which is openly available for you and which I administer and constantly add new content to as well. We're going to explore selected data sources. Now, There were so many that I had in mind and so many topic areas. And I shared, just as something of interest, I shared this with Dr. Lori just to say, you know, were some of these topics ones that would be appropriate? And she said, yes, but we only have 90 minutes. And I was, yes, I know we only have 90 minutes. So I hope that we can continue this conversation, because I had to be very careful and thoughtful of which of those topics or sources that I would then transfer for our short talk today. And I also want your engagement, so I will be stopping occasionally to ask questions of you. The first one we're going to look at is the data sources around the global burden of disease. And in particular, data sources looking at the global burden of disease, GBD compare. We looked at this in the May Institute, but today we're going to take that deeper dive I talked about. It's not going to be everything that's available in that particular tool, but it's going to get you started with an understanding of how this tool might be able to be appropriate for your research. Again, the next piece is COVID-19 in the sexual and reproductive health context. Everything that we are looking at in the world today, I really do not have to tell you as clinicians, as providers, as researchers working in this area, we're all working within the lens of a global pandemic. So once again, there are data sources and tools out there that we can use to enhance the work that we do in these areas. And time permitting, I'd like to take a look at the quite new World Health Organization's Sexual Reproductive Rights and Rights Portal. Again, this is a relatively new that they've really introduced, thinking about how to bring together data that represents reproductive health rights. So, okay, so it's time for a question for you. And this also includes Dr. Lori. Are there openly available, and remember, I'm talking about openly available, open data that's available to all of us and it's equitable. Openly available data or statistical sources from trusted sites or organizations that you commonly use in your own research, learning, or teaching? So I'm going to give you a couple of minutes. I'd like to see how you can answer about this one. And you can share in the chat, but as we're doing that, I'm going to put Dr. Lori on the spot and ask Dr. Lori, are there any sources that, again, openly, freely available that are ones that are in your toolkit?
There are, and very luckily for me, we have a great library resource here, and we have a great librarian to help us with that. But I often, I do use open sources, and I often direct my students to open sources. For one thing, whenever anyone is traveling, I always recommend that they look at the DHS data.
Yes.
The demographic health surveillance data, to kind of get a snapshot, kind of a big snapshot of the country that they are going to be visiting. And then I also, this is less for research, but more for just an understanding of a place, is to also look at a ministry's website from a country to get what their strategic plan is and where they are going for reproductive health in their particular country.
Excellent. And those are ones that I'll always recommend to our students and our faculty. And I actually wrote them into our chat as you were talking about them. Are we getting anything else in our chat in regards to what other people might use? Or by the way, we are a community of learning here. So don't think I am the only one teaching. There is a great deal of teaching that you have to do, and within this wonderful cohort of the School of Nursing Summer Institute. So I don't know if I'm getting anything yet, but a lot of good nights and a lot of hellos. So I am going to hold this question, but do not think I have let you off the hook, because maybe this is a question that we add to our Canvas site for continued discussion. So I am going to have this continue, and I really hope, Dr. Lori, and Janet, that we can add this as a thread where we can do some learning and learn from each other as well. So that's really important. I want to learn from you. Oh, we have this wonderful, wonderful idea about the World Bank open data. That's one of my absolute favorite sources. The Open Data Repository, another fabulous one. Thank you for adding that one. So keep those coming and keep thinking about that, and we will continue to do that. The DHS, my dear friend, Amelia Udofia from Ghana. Thank you for adding. The DHS is often used in Ghana, and I've actually used it before I've traveled and worked in Ghana as well. I believe we have a raised hand. Please go ahead and type your question in the chat box. So I'm going to move on, but keep thinking about this question and we'll add it to our Canvas site. Speaking of our Canvas site, just to remind you, this is our site. And of course, we have our home, we have our recordings, announcements. Then we have a section called Library Tools. And when you click in that Library Tools section, what you're going to find is some of the global sexual reproductive health information sources. The first thing you'll see is your course, your institute informationists. And that includes me, Gurpreet Rana, and it also includes Catherine Vanderball. And I'm very excited to say that you'll be seeing Catherine for a webinar on Zotero in January. So please keep your eyes out for that announcement. Another thing you will see is our research guides. Today, our focus is going to be of accessing information from our freely available open access guide, Global and Sexual Reproductive Health. Another one that I always just like to share and make sure it's available is our COVID-19 research guide. This focuses on international data and scholarship on COVID-19, but also looks at the United States and our local issues here in Michigan. But again, thinking about that aspect might be interesting. Amelia's coming up with great ideas. The mix survey is an excellent one from UNICEF that I think is very good for, of course, more local level data. And yes, it is open source. I believe some sources do require you to register. So for instance, DHS data does require you to register, and other sources do require that, but many of them are still freely available even with registration. So let's move forward. And we're going to be taking a look at the Global Sexual Reproductive Health Guide. And before I actually introduce the entire guide and we go through it, I just wanted to take you through the navigation bar of it. We're not looking at every single piece of it, but we're going to look at the pieces that highlight the aspects of sexual reproductive health data. And those are the interactive reports, of course, the data sources, infographics, and today our focus is going to be the global burden of disease. So again, this is an ongoing tool for you where you can look at ebooks and publications, policy and practice sources, mobile resources as well. If there are ones that you believe that you'd like to share, please do so, and we can definitely curate and take a look if those are ones that we need to add to our research guide. And of course, our sustainable development goals as well. So you can see the different tools here. Let's take a look at these. And I'm going to go live into the guide. If we have any technical issues, I will be going into screenshots, which I have saved for you. And what we have here, of course, is our guide. In one section on the right-hand side is we have a resource spotlight. And you'll see that IMAP, which is a source, and I'm not going to focus on this, but in research, there is a reproductive health in the time of COVID guidelines from the International Planned Parent Federation, which I've included there. The new portal on WHO sexual and reproductive and health rights. And you can see some of the others there. Also some new and noteworthy tools. There is a female genital mutilation cost calculator, which I find very intriguing and would encourage you to take a look. You can see news sources. But let's take a look at this interactive global reports. This takes us out to another source. And what we have here are sources that include data. Many of these are annual reports. I'm not going to go into any one of them right now, but I wanted to share with you the fact that there is our very new from UNFPA, the State of the World's Midwifery Report 2021. If you have not had a chance to take a look at it, I do encourage you to do so. And by the way, I will put the link to the guide in here as well. So it's in your chat. Also, looking at one of the newer ones is the FP 2020 report, the arc of progress for 2019. So what has as we're shifting from family planning or FP 2020 to FP 2030, what are some of the things for us to look at? Also, when it comes to sexual and reproductive health, an aspect of data source that we really do need, and again, I'm picking out pieces here, is the UNHCR. The aspects of refugee and displaced persons for so many reasons: conflict, war, climate refugees, so many different reasons for that displacement. And looking at the numbers is very significant because of the population, as we know, of women and girls requiring reproductive health. Of those 82.4 million people at the end of 2020 who were displaced through forced displacement. Now, of course, that number unfortunately has risen in 2021. So just to take, I'm not going to focus on these, but the reason they're called interactive reports, a good example of this would be the UNFPA report. When I go into it, the reason that it's interactive in nature is that I'm just going to skip the introduction here, but this particular report from 2021 is about bodily autonomy. And when I go into the actual report online, there is a PDF version as well. But when I go into it online, what I see as I slowly scroll down is a way for me to interact with the report, read a story here. I can stop and watch a YouTube video. So it's the fact that it's integrating different types of media, infographics, YouTube videos. Looking at some of these, some of the reports have various reports that are animated or charts of data. I can go into certain sections here. So if I went into one on reproductive coercion, I can go into that and investigate that area more. So again, looking at these various tools, this is, of course, the State of the World's Population from 2021 report. And there is a PDF, you can download it or print it, but I often think that there's a value from learning from using these in the online version when they have that interactive approach to the report. So let's go back to looking at the guide. And I'm going to skip over and look at some of our slides for now. One of the sections is the data sources section, and this is going to be the one that I'm really highlighting today. Is, of course, these are not all of the data sources available. You know many that may not be on here. These are open free content sources on sexual and reproductive health that I believe to be useful. We can't include everything in here. This is not supposed to be a directory or an index of all of the data sources out there, but just ones that may be of great value or recent or focus on particular issues. You mentioned some of these, including World Bank Open Data, which is further down on this page. You mentioned the Demographic Health Survey, and I believe MIX is also on this page as well. So looking at some of these tools can be very helpful as we look at the concept of either sexual reproductive health or the environment and landscape within which we work on sexual and reproductive health. And I encourage you to also share with your students and your colleagues. Another section that I think is very important is looking at our navigation bar. I'm now on the infographics section. and looking at infographics from various organizations, both in instruction and in health promotion. So how do we think about health education and health promotion, especially as nurse midwifery workers, especially those who work in the community health workers, thinking about how can tools get a little more focused on maybe a wall chart, or maybe it's something that you show on a phone, a way for easy information to be developed and shared. Many of these infographics in family planning or in sexual health have aspects that are focused in on very much on, I'm going into the guide itself, on different languages as well. One that I really believe to be useful and intriguing are the ones from the FP 2020. So just as an example of the guides, of the infographics we're looking at, here's one called A New Infographic. You can see this is really important. The date it was published, the source is the World Health Organization, and there's a brief description of it, that this contains messages for health workers, governments, survivors, and support persons to respond to violence against women in the COVID-19 aspect. So FP 2020's Knowledge Center has organized these. And then what I did is I went into here and I identified, you can see the different tools here. I checked on the box infographics. So there's other types of publications I can look at. I wanted to look at infographics. And when I go into that, I can learn more about it and then see the actual infographic and it'll take me there. So these are a set of infographics in regards to aspects of community health. So here's the one on violence and COVID-19. As we know, unfortunately, there has been that increase in violence, gender-based violence and intimate partner violence amongst women during the COVID-19 epidemic. So you can see that this might be an infographic you might take pieces from, ideas from, or you will print out and put up on a wall chart or share in some way. So that's why I think that infographics are an important way of also presenting data. So you can think about how some of these infographics are presenting data to communities or to fellow researchers, and use them in a similar way. So thinking about these as research tools, but also health promotion. The next one on my list is the global burden of disease. And this guide looks at several of the data sources, the data visualization tools, and some of the other information around the global burden of disease. Now, we're going to focus very much on one tool today, but I encourage you to watch the YouTube video on the newest data set, which came out last year. It's the data set for 2019, and it's very significant because this data set came out, this is data about our world just before the pandemic. And what does it tell us about our communities? We'll look at that in a moment. I'm now going back to my slides, and I'm going to start my presentation again. Okay, so going through some of those, some of the slides I was showing you, let's now take a look at that deeper dive into the Institute of Health Metrics and Evaluation, IHME, which is where we find the Global Burden of Disease, GBD Compare instrument. So I'm going to click on this link, and by the way, you will be getting my slides. I just wanted to make sure we went through this. Many of you may be aware of the Institute of Health Metrics and Evaluation at the University of Washington in the past 2 years because of their significant work in COVID-19 projections around the world. So the work that they're doing constantly, they're putting out new projections for every country and the world, and even some subnational level data for states in various countries. But what I want to focus on is their global burden of disease study. So we can see, yes, we can look at COVID-19 projections, COVID-19 data, For those of you in the United States, there is a focus on other aspects of domestic health. One that I think is very intriguing as well is to look at their financing of global health. So financing or development assistance for health numbers for funds that are shared from one country to another or from one organization. As an example, the Gates Foundation to organizations, and where is that money going? To what areas of study? Is enough of the funds going towards women's health? Are enough of the funds going towards sexual and reproductive health? How do we know this? We can take a look at this financing of global health report, the data that is available in a data visualization tool based on this report, and investigate that. So not today, but we will. And you can see right in the very middle is the Global Burden of Disease Study resources. So we're going to click on that. This is one way of getting there. Another way of getting there is going to their projects list along the top and clicking on Global Burden of Disease. Now, most of the studies related around the global burden of disease are published in the Lancet, and they're published open access. So they are accessible to anyone. The actual study, the 100-page study with so many data points, is available through the Lancet. But sometimes there's so many small itty bitty data source points that it's difficult to see the broader picture. So that's why we focus on using data visualizations here. One thing I do want to point out is when the new data set for 2019 was published, and you can see the various languages you can read this in. And last year, it was October 30th, I believe, 2020 is when it came out. Just by looking at the data, there was what they called a syndemic of looking at what they called the perfect storm of chronic disease, inequity, and the vulnerability of a population due to other health conditions related to just how COVID-19 was able to take hold. So looking at this brief blog post gives us a better understanding of what they meant by the global burden of disease estimates revealing a perfect storm of chronic disease and public health failures. So I encourage you to look at some of the literature around that as well. We are going to focus on the global burden of disease. You can see there's the data resources, data visualizations, country profiles, infographics, and these are more scholarly type of infographics for learning, for your learning, and for your sharing with students. But we're going to look at the data visualizations, and I'm going to click on that right now. Before we go into their flagship data visualization on global burden of disease, let's look at some of the more recent ones that have come out. There's one based on the Financing of Global Health Report 2020. You can see others on epidemiology on different countries, such as there's one specific to India. There's ones that are specific to aspects of one that I find to be very useful and intriguing are ones that are focused on health services. So that's something to think about as well. Now, we are going to go into GBD Compare right now. So here it is. And again, I'm toggling back. I'm going back to my slides just so you know where I am. And I'd like to take you through some of this through my slides as well. So we reviewed this. Here is the global, this is our guide, the one that I've created for you. And on our global burden of disease page, you can see a direct link to the data visualization global burden of disease right here. So as opposed to linking to any particular page, I would ask you to bookmark the entire guide and then just go to the navigation part for this. So we want to bookmark the actual guide or keep that in mind. And here is the link to the guide in the chat. and then just go to the right, the navigation page. So we're navigating to this part of it. Let's take a look at healthdata.org, which we did go into live to look at it. We went into the global burden of disease. Here we are. We can download all of the data points into an Excel spreadsheet or look at it in that way using some of the data actually that's available to us from here. But I think there's some power in the visualization as well. So let's take a look at GBD Compare. Here it is. And when I click on the actual link to go in, this is what I see. I'm going to click on this link so you can see as well. I have links to all of these, all of the screenshots, so you have a better understanding of what we're looking at. What we're looking at right here are the dailies, the disability adjusted life years for both sexes, all ages for 2019. Now, what can I do with this? Well, I can move this around. The Global Burden of Disease Study has been collecting information since 1990. When I look at the world in 1990, I see that this pink color or the red, the hot colors, are larger in proportion than the others. And this refers to nutritional, communicable, and maternal disorders. So that's what we're looking at there. So we're looking at diarrhea, malaria, HIV, neonatal disorders, maternal disorders. What we're looking at in blue is chronic health issues. So this could be stroke, lung cancer, back pain, anxiety. So these are aspects that are non-communicable and chronic disease. What we're looking at in green are injuries. This can be road injury. It can be war and conflict. It could be falls. It can be burns, that type of thing. Self-harm, drowning. Let's go back to we're just going to scroll back to 2019 and let's see what's happened to the world. And this is what really came out in the 2019 data set is more than 50% of the world's global burden of disease, all countries that are reporting back, I believe, and I do not quote me, but I think that's 194 countries. I always forget the number. We'll have to make sure about that, but it is over 190. And what we're dealing with right here is looking at the fact that the majority of the world is the burden, the largest proportion of burden is chronic disease. But that does not negate the aspect of the others. So that's significant. However, we can change our populations and see how this changes. If I change from all ages to the age group 15 to 49, which is more closer to women of childbearing age, what I will see is, I do see an increase as we see here, but now I'm going to change it to female. So 15 to 49 female. And what I see is, yes, there's still that burden of disease, more chronic in nature, but now why are these darker? These are larger. First of all, maternal now has become a bigger square in what we call this tree map. And what this means is that there's a larger proportion of women, their burden of disease is between 2.89 to, no, excuse me, it's 3.46% of the burden of disease for women 15 to 49 in 2019 was due to maternal disorders. Now, why are some of these darker than others? The darker ones mean that the annual percent of change, the percent of change there has been an increase in that burden of disease from 2018 to 2019. So for HIV/AIDS for females 15 to 49, it is 5.07. That is an increase of 2.13, and that is why it's darker. So the larger the square, the larger the proportion. The darker the square, the increase in the rate of change. So you can see what we have here. Now, of course, if I change that to under 5, it's going to go all into infectious disease, because the disabilities, and the years of life lost for a population younger than 5 is often going to be communicable disease and neonatal issues. If I look at 70 plus, we're going to go all the way chronic, because if you've lived that long, that's usually what we're looking at, right? Now, let's go back to female 15 to 49. I'm going back to my slides. And I have a question. This is just one I thought of, and I thought it's a very good one for us to see how the Global Burden of Disease data tool works, the GBD compare works. I want to compare the disability adjusted life years for maternal hemorrhage for women aged 15 to 49 in South Asia. I want to assess burden over time, by cause, by risk. So and the risk I want to look at is maternal hemorrhage attributable to iron deficiency. Let's see if I can make this happen. I have another question. What is the prevalence and years of the YLDs, the years lived with disability, of anemia for this population? And how do countries in South Asia compare? The reason I chose South Asia is because there's 7 countries. It's a set that we can easily see on a screen. That's the only reason I chose it. Not that we shouldn't be looking at other regions or other countries just as specifically. So let's take a look at this. And I'm going to take us through slides on this first. This is the one we saw before, the global burden of disease, the entire world. So let's take a look at this. And let's then see how we can take a look at the burden of disease for women dailies. Now, we saw this as well. We just looked at this. This is looking at the dailies. So I have kept it on cause. You notice how I'm using this tool. I clicked on dailies. I changed the location to South Asia. How did I do that? I'm back looking at my screen. I'm going to change global, and then you see all these countries. And in some cases, I even see regions within those countries. One example that immediately comes to mind, Mexico has subnational locations, so provinces and areas within that region. Brazil, Kenya is another location, and the United States has subnational information. I'm going to look at South Asia as a region. So in this location box, if you can see that, I typed that in. I'm going to click South Asia. And I'm then going to change it to 15 to 49 for females. But then if the question is, we're looking at maternal hemorrhage, how do I see that? So there's so much data and such a rich amount of data collected here. I'm going to change my settings. And again, this is just a tour. I'm not asking you to go through every step and understand it. I just want you to have the tools here for you to practice after our session. I'm changing the setting to advanced settings. So that's one thing I can do. I'm going to change it back to basic. Then what I can also do is I'm going to change this to 2019. For some reason, it wasn't there. And then what I want to do is explore from the point of view of, I'm going to click explore. And when I do that, I now see a map on top of the world, and I see our tree map below. The map settings. So looking at the map, I'm going to increase the size of the map, and I'm going very slowly on purpose. And I'm going to change this from all causes. And before I go forward, I want you to take a look, if you can, to see all the different types of causes that have been measured and assessed in the global burden of disease using and curating so many data sources in a very systematic and strong methodological manner. I'm looking at diarrheal disease. I'm looking at infections. So all of A is that hot red color. All of B is when I'm looking at chronic disease. So you can see all of the various chronic diseases that are listed out here. When I get to this section on C, I'm looking at aspects of injury. It's venomous animal contact. Well, that doesn't sound very good, but it is an injury. We're going to go to the very top. And you know what's so difficult to find things here? I'm going to type in, I know this exists in the maternal disorder section. Let's go there so you can see it. I'm going to type in maternal. So here we see the maternal disorders that are available for us to take a look at. I'm not going to look at I'm going to look at maternal hemorrhage. So there we are. We're looking at maternal hemorrhage, females 15 to 49, 2019, disability adjusted life years per 100,000. I'm going to increase my map size and go in on specifically looking at South Asia. So here's South Asia. Again, I just chose it because it's a small regional area, it's compact. So we were able to take a look at it on our screen. And this looks very interesting. Look at the different colors. So the warmer the colors, the more significant the issue, the higher the dailies. Afghanistan has a maternal hemorrhage of 843.2 dailies per 100,000. That's very significant. When we look at other countries around it, so if we were to compare this, let's say to China, for instance, 8.53. Then we start to think about the differences and the issues and going into the scholarly literature to understand better what's going on in Afghanistan. One thing that we know that's going on in Afghanistan right now is conflict. So we can conjecture, we need to go into the evidence, but we can conjecture that some of this has to do with war, conflict, and possibly with refugee and displacement issues. Now, Pakistan right beside it is 467, India 265. You can see Bhutan, Bangladesh, and Sri Lanka, and Nepal is in there as well. So we're looking at this environment and seeing the differences. So what can we look at now? Well, I'm going back to my slides just to take us through there. You are now looking at what we were just looking at. We were looking at the cause, maternal hemorrhage, the dailies, ages 15 to 49, female rate, and for 2019. So this is a very complex tool, and it's not one that we're going to learn just in this session, but let us see some of the other things we can do with this tool. Looking at my slides, I have a link here to this particular slide. So you can go and take a look at exactly what I'm looking at. I decided to take a look at risk. I'm going to go back to my slides here. So here we're on here. I'm going to go to my shared settings here. I'm going to use advanced settings. Now, I have the option to see risk. I'm going to change it from all risk factors, and you can see all the various risk factors. I'm going to change this to iron deficiency. And I want to see this in females 15 to 49, and I want the cause to be maternal hemorrhage. So what does it now say at the very top of the screen, where it's telling me what this map shows? It says maternal hemorrhage attributable to iron deficiency, females 15 to 49, the year 2019, disability adjusted life years. So we are now looking at a perspective from a cause and the risk. Again, we have Afghanistan at 159 dailies. We have Pakistan also a little higher than the rest, but Afghanistan and Pakistan are higher. We see India at 65. We see the other countries at lower rates in that region. but still ones that are significant and to be concerned about. So I'm going back here, and I know I'm showing you some very complex tools, but this was my purpose, so we can get introduced to them, and then you can then practice using the slides and going forward. I also am in the process of creating a module that I'll also be sharing on our Canvas site that helps take us step by step through these. The next thing I take a look at, and what I'm going to do is let you see, you're going to use slides, but I want you to see there are various ways we can present information. The map, then we have a tree map. So on the left side, we have different formats. And if you see, this one is called risks by cause. As I toggle down, an arrow diagram, a pyramid, patterns, heat map, plotting of data, and line data, or ways we can see really content over time. So there's so many different ways that we can present information. And I'm going to do this only by using some of the screenshots here for now. Let's look at our next screenshot. And remember our questions. We're really investigating the cause, risk, and dailies, and the years of lives lived with disability, that YLDs around the aspect of anemia, iron deficiency, and maternal hemorrhage. Next, I decided to look at impairment. So there's cause, risk, impairment. And one of the impairments I can look at is anemia. I'll take you right to it. Click on impairment. And one of them is anemia, epilepsy, heart failure, infertility is one to look at, pelvic inflammatory disease, so many that are related to areas of sexual reproductive health. I can look at years lived with disability or prevalence. So I'm looking at prevalence here. And India has a significant, based on the countries around it, has a significant aspect of anemia amongst women. So we're looking at women age 15 to 49. I can age standardize that, or I can look from different age specific, or I can look at different populations. We're looking at 15 to 49. India has almost 50,000 prevalent cases per 100,000. So that's an intriguing thought for us to look at. What about the YLDs, the years lived with disability? If we change it to that measure, we see how India is still ahead of the others from that perspective. So how does it impact the years of our quality of life? Next, let's take a look at our next screenshot. And we went into the tree map. And I'm going to go back, I'm toggling back to the screen, and I'm going to the tree map. I thought I was going to the tree map. One moment while this loads up. What I'm looking at now is, again, I'm looking at South Asia, females 15 to 49, the prevalence of cases attributable to anemia. So what aspects? There's gynecological disease. Of course, there's iron deficiency, sickle cell, period. So what aspects of each of these has some perspective when we look at prevalent cases attributable to anemia, and others that are prevalent cases not attributable to the particular area. So that's what we're looking at here. Next, what I did was, now I am looking at, if you look at our screenshots, I'm going to stay with some of our screenshots. What we see here is the next screenshot is looking at this information in this format. So the next one on the list here. below tree map. So we're looking at how it's presenting here in this graph form. All factors, South Asia, and now we see aspects of risk, unsafe water, intimate partner violence. We can see that information. I'm going to click on this link and take us there. By the way, as I'm going through this, Dr. Laurie, could you give me some thoughts on the type of data we're looking at and how useful you believe it to be for the work we're doing?
Yes, this is really incredible information, Preet. Thank you for sharing. I think that this can be used with teaching our students. I think it can be used when people are thinking of applying for grant funding, if they have research in a certain area, to show the burden of disease, to show the prevalence, to show how something that they may do as an intervention could impact a country or an area of the world. I think this has a lot of use, and the visualization of it is so helpful just for understanding and for seeing change over time. I really appreciate this.
So speaking of, first of all, there's different ways we can share this data with others in reports, in grants, in publications, and in classrooms. So if we click on share, we can you can copy this link just like I did, and then present it to students real time, as long as we feel that we have a strong email connection there. Email. It also allows us to even put it on Twitter. The other thing it does is we can download screenshots. So if we click screenshot, it will download the screenshot information. If we click on the next download option, which is GBD results tool, that takes us to the actual data set from which this information comes from. So that is in itself very intriguing, that we can download this data into an Excel spreadsheet or look at it from different perspectives. We're not going to be focusing on the actual data, but the data visualization today. So when I hover over each of these pieces, you can see how this information, the disability adjusted life years, and how it affects, we're looking at all risk factors, but we could look at specific risk factors as well. Child and maternal malnutrition, for instance. Now, the level, if I'm at level, what does that mean? Level 1 means that I'm looking at broad behavioral, metabolic, environmental risk factors. 2 is going to become more granular, more detailed. So how do you see now it says intimate partner violence, malnutrition. If I go to 3, level 3, now what we're seeing is much more detailed. Now it says unsafe sanitation, child growth, sexual abuse. If I go to level 4, the furthest we can go, it then allows me to see even more detailed information. And again, I am looking at South Asia. I can, of course, change this to other regions. So if I was to change this to, let's say, let's look at Brazil. So for instance, I would then, of course, the numbers now change and represent Brazil and all risk factors for females and the rate for that population. I can look at numbers or percentages, but I believe rates are very appropriate for presenting information and for comparison as well. The next piece, and that was looking at what we call the risk by cause diagram. Now we're going to look at the arrow diagram. So that's what we have right here. When we look at the arrow diagram, what this shows us is significance of changes in a population. So here's, again, this is 1990. I can change that to whatever number I want, 2011. Let's see how there's been changes in our population in South Asia. Well, what is the #1 rank for dailies for that population? Well, maternal hemorrhage went from rank 11 to rank 18 from that time. let's look from 1990. I'm always very interested in how it's gone from there. So it went from rank 4 in 1990. There has been a decrease by 78%, and now we see it at ranking at 18 for that population and age group. Remember, wherever it is blue, that's chronic disease. Wherever it is red, that is maternal, neonatal, communicable, and nutritional issues. Wherever it is green, we are looking at aspects of injury. So we can see how that changes. There's also an issue of changing when it looks at different populations. So if we look at male, what I've always found interesting is the injuries always go higher. I also noted is as we look at populations in 2019 or after, as we go forward, the blue for any population goes higher. So chronic illness is going up further. However, if we just look, instead of all causes, we look at maternal disorders, which ones rank higher in the burden of disease? Now, where'd they all go? Oh, here we go. You see, as I'm looking at the levels, the granularity has changed as well. That's very strange. I'm trying to look at maternal and neonatal. So this is how we're seeing that the change. You know why it's not working? It's because I had it on male. We can't look at maternal issues in men. There we go. So now we're looking at the further granularity of that information when it comes to aspects of maternity. So again, I'm going to remove all of those except for maternal disorders. So now we're seeing maternal hemorrhage. So it's pretty much stayed the same there, but how have others changed? Where do we see these long lines? Where's one of the major long lines? Maternal abortion by miscarriage is lower. Some of them have stayed very much the same. So that's an intriguing way for us to see that information. The next way is for us to see this pyramid. And when we go into the pyramid, this is what we see. And it gives us some countries and it gives us some numbers we might be interested in looking at. But I changed the pyramid settings to represent countries in South Asia. And again, only having done that because it makes it be only 7 countries, it's easy for us to see on the screen here. And then what we're seeing here are, again, another way for us to visualize that population. So again, if I change this to maternal hemorrhage or another issue, I'm going to stay with maternal hemorrhage just to keep it the same. Now we see how that can't be right. Something's wrong. There's no male maternal hemorrhage. So you can see how even a little. I changed that on the map setting, so I need to change that on the pyramid setting. So what I need to do is change the cause here to more of the maternal issues here. So if I was to change it to maternal and neonatal here, what we will then see is the neonatal will be there for a child, but of course, when we look at the maternal issues, we're only looking at females. So as you can see, I am also a learner when it comes to this tool. This is something that it's complex, but still, I want to encourage you to think about it and take it, go through it. Here I'm looking at, in this screenshot, I'm looking at risk, I'm looking at location, cause, maternal hemorrhage, South Asia. And here I see those changes for that particular population. I see how this is then changing when I look at the pyramid that we just looked at. I don't want to focus too much anymore on the various areas because I want you to investigate, and I also want to quickly create that module for you to learn in bits and pieces for each one. The various patterns we were looking at. For today, I'm going to skip over heat map and plotting and have you take a look at by time, looking at this information here. So what we are looking at now is called the line. So I can add lines here. So what if I added all countries from Sub-Saharan Africa into this? So I'll be looking at South Asia and Sub-Saharan Africa, or I could look at one or the other. I could add in different countries. One's, let's say I'm working in Ghana, Liberia, and Zambia, I think it is. I think I'm trying to think about some of the countries that Dr. Lori works in and comparing those. So looking at what we have here, so what is that? How does that change? I can then look at the ways that I'm comparing this information either by location or by years. And here I see which populations have how they have been doing. And usually I would not want to do so many all at once because it's difficult to see. And that's why I was focusing only on looking at South Asia because of the 7, that's easy to just see those. And there you can see those, and these are live. So these live data visualizations allow me to play with the information and click on and focus on a particular aspect and then take it through and look at other sources of that. So I hope I have not confused you too much. It is a complex tool, and it was an idea for you just to understand a little bit of the power of such a data visualization and the power of the global burden of disease study when we are looking at it in the context of maternal, neonatal, child health, and sexual and reproductive health. So thinking about all of those aspects and ensuring that we do investigate those with our learners, with ourselves, and with our communities. So before I go on, I have a question for you, and maybe Dr. Laura, you might want to start off on this. How has the COVID-19 pandemic impacted the way you use information sources?
Well, that's an interesting question.
It's a very broad question. It can be answered however you are perceiving it to, whatever it means to you.
Sure. I guess that when I think about how COVID-19 has impacted the research that we do, I think it has impacted the way that we are probably sharing resources. So it's less face-to-face sharing with colleagues. It's more sharing this way via Zoom and via webinars. So I would say that it's at least information sharing has changed. I don't know that it's changed the way that I use information resources, although I certainly follow the data on the pandemic from multiple sources, from the CDC, from Hopkins, and from WHO sources. Right. So I guess I'm really, and from our local health department, to just see what the pandemic is doing in our particular area of the world.
Those are all great ideas, and those are great sources as well. And when we think about our world in that context, as a global health informationist, a great deal of my work has become making sure that those that I work with, including this wonderful group from the Global Institute, is ensuring that people have the sources or know what is available to them to consider when they are thinking about their various areas of research in the lens of a global pandemic. Of course, this is not the last pandemic we're going to go through. I often have also thought about how it impacts women. As we know, vulnerable populations get impacted with health issues significantly, and like all of these, women and girls have had significant issues of impact upon them. So it becomes inherent in the work that I do to ensure that there is some way that I'm making sure that information or information resources that represent their interests are ones that I'm sharing with the nursing, midwifery, community health worker community that I work with as well. So let's see, there's a comment here. We did not have access to, there's a lot of courses that became available online. That was like opening a gold mine to me. I also find that very interesting, and something that I just wrote down as you were talking, Dr. Laurie, was equity. And what a side effect of COVID-19 has been greater, the opening of course content, the opening of publishers making their COVID-19 information and data available more broadly and without charge. We are thinking more about the world in an equitable way as researchers, and more people want to publish in open access journals. So this may seem like something that you may not have thought about, but it's something I think about a great deal right now, is the aspect of what we call bibliodiversity. And maybe this is a conversation for a future time, but the idea of making sure that all voices are heard. So LMIC researchers in lower middle income countries are doing excellent research. Is their research reaching the high impact or the journals that the world reads? And if it's not equitably shared, why is that the case? And so this idea that Amelia, thank you, Amelia. You've been like, every time I want to bring something up, you're right there. I really appreciate it, and it's good to hear from you again. So one thing is, again, what you brought up is that idea of the increase of sharing, the more thoughts about equity in our environment. I'm not saying this is all about COVID-19, but it is one side effect of it. And it's one that I think we were experiencing in our world. And if it's happening now, is there a time when we are in whatever we want to call post-pandemic? How is that going to affect the way that we share information? So again, what Dr. Laurie was saying, the sharing of information. So one to think about, so keep thinking about that. Maybe we'll set up another little Canvas discussion on that. So what I did was I investigated some tools that I thought could be relevant and useful to you. This is not everything. And I wanted to definitely focus on data or statistics as opposed to the scholarly articles. There's so many of those that we can look at as well. But I decided to look at FP 2030. Again, the site still says FP 2020, but FP 2030 is ready to be launched. And then I started looking at some of the other content that it's relevant to issues of gender equality. And lastly, I wanted to make sure that we addressed aspects of the global supply chain in the SRH context. I was very intrigued to see what data would be out there. And so these are some of the data sources that I decided to investigate and find out more about. And these, and so what I wanted to make sure that we looked at are some of these, and I did create screenshots for these just in case we weren't able to go through them. But let's go ahead and click on this. This is, I'm going to click on that link there. This again is on our Global SRH Open Guide. I know that many of you are familiar with Family Planning 2020 and the work that it does to ensure data, information, and content in regards to aspects of contraception around the world and research, of course, are made available to you. So let's say I was to look at Indonesia. I'm going to look at Indonesia because I think there's several people on this call from Indonesia. They keep saying hello. or they keep saying good night, actually. So I know it is quite late there, and want to thank them for being on this call. So looking at this, of course, we see we can take a look at the data and an overview of family planning and contraception data. And this is something we did take a look at during our session in May, if for those of you who joined us. So what we here have is a progress report on aspects of contraception, unintended pregnancy, and you can see the PCR reports here as such as well. So, but looking at this as well, there is all in these sections for these countries, there's a section on COVID-19 and family planning. So when we look at Indonesia, what are some of the links that FP 2020 has believed can be relevant? There's some information here when we're talking maternal health services take a hit amid global lockdown. These are news articles, but they're ones that have been reviewed by FP 2020 and seem to be appropriate for sharing. Unwanted pregnancy, here's World Population Day. Here's an article on the lack of family planning access due to COVID-19 and what could happen in Indonesia. And I found this to be very interesting, the fact that we've included this in the data source of it. Also, there's this link that allows us to link out into the COVID-19 family planning data information that FP 2030 makes available. So this is a broad source of information, and then allows us to see some of the information around guidelines, checklists, and other related practice reports and briefs on data in regards to COVID-19 and reproductive health researchers and providers and various capacity needs, statements, etc. So looking at that from the country level and then going into a more broader level allows me to see that. And by the way, I think I said PCR. I always say that when I refer to MCPR instead of, I just have PCR testing on my mind right now. I really meant to say MCPR, not PCR. I also, there's too many letters in our heads, aren't there, with all these different types of short forms we have for names. So then another one, again, just going through here, I went through it in Bolivia using that as a screenshot. Another one that I found very intriguing was the tracking of the situation by UNICEF. And yes, of course, UNICEF is focused on child health. And that again is something that's relevant and focused for us, especially for you as community health, nursing and midwifery researchers and teachers and learners. But in addition to that, there are some important aspects here. Of course, I can include, I'm just going to take a look at, let's say, West and Central Africa, and then look at, I can look at all countries, low-income countries, I'll take a look at all countries. And then we're looking at here are different aspects that impact our health. When I look at aspects of gender, we are definitely going to see different intriguing points. And by the way, this came out in November 2021. So this is as recent as UNICEF can make the data. And I don't know if you can see this very well because it's rather small on the screen, but there is some aspect in regards to aspects of maternal nutrition child health services, but also aspects of vulnerable groups and the responses that are being made, social protection measures, of course. So when I take a look at WASH, here's one on the comparison for pregnant women. Let's take a look at that. And based on that, looking at family planning in that region, what are we seeing? So if I scroll over the areas, I see the countries that have responded to that in that region. I'm going to change this to the world just so I have more regions to show you. So now the map here now is going to change to, I think, 124 reporting countries for family planning. So what do we see? Where do we see the increases? Where do we see the drops? Where do we see less than a 10% drop, and it shows us the countries. We also see the places where there is no change. This allows us to also not only see how countries are presenting, but I wonder if it would allow us to start a conversation about supply chain. Maternal services. So where do we see that? Again, maternal services delivery care, and you can see other sources that are related to that. When I look at migration, again, I always come back to the women that and the girls requiring reproductive health and migratory flow that has been impacted by COVID-19, which is quite significant. And there's also tools that we can, and data visualizations through what we call human mobility through COVID-19 that can show us that type of data. And here we see any type of stigmatization, social tensions, when we're looking at communities, and also nutrition aspects, WASH, again, having to do with aspects that are relevant to those who work in sexual and reproductive health. Education, I always find this intriguing, how education of girls has been impacted by COVID-19. And we know the significance of education when it comes to sexual reproductive health and how that could have a lasting impact. So again, just something to think about as we're looking at data sources. These are just a few, just a snapshot of the ones that I found to be intriguing and useful. And here's just a screenshot of me going through one of them. Then I started thinking about COVID-19 and the SDGs as the Sustainable Development Goals and that particular perspective. And one of the tools that I found is from the United Nations Development Program on COVID-19 Data Futures. And here in this piece, it talks about how there's been special focus on the Human Development Index and the idea of modeling scenarios of how governments can make choices today that have the greatest potential to boost progress for the future. And what does this include? So let's take a look at this, this impact document and what does this mean for us? Again, this is a tool that I just started to investigate and I wanted to share with you. So look at this. I'm not doing this. This is actual an animation that's taking place. So what they are showing is an analysis of how the SDGs could be impacted with what we call a baseline COVID scenario, a high damage COVID scenario, and the SDG push, which outlines the programs that allow for targeting of the actual reports. And by the way, you can replay this if you're in front of a group or an organization or students that you'd like this to see. As I scrolled through this, I thought it was very intriguing to look at how I could look at the COVID scenarios when it came to female poverty, neonatal mortality, maternal mortality ratio. So I looked at maternal mortality and I decided, I looked at all countries, but let's take a look at Sub-Saharan Africa. So what we have here is the no COVID scenario. I'm going to include that. And it's taking a moment, I think, or maybe it's not coming up at all. Let's go back to the world. One never knows why these things happen. So the no COVID scenario, it's very light, so you might not see it. What we call the baseline scenario is right there, the high damage scenario, and the SDG push. So what do we see between the projections of what is possible if countries or if regions are not do not keep track and keep hold of the impact that COVID could have on their SDG agenda? Look at how you can download this image and present it. And again, cite it very well, as any librarian will tell you. You can export the selected data. Again, a really good showing of a good source is a good data source is the fact that you can export the data into a spreadsheet or into some format that you can use it for your own work. Or let's say in a survey you're presenting, you want to include or perspectives of this data in there or sharing online. So I just found this to be a very intriguing piece when we look at all aspects, female poverty, maternal mortality ratio, and all the things that affect aspects of health in those communities. And then looking at different geographic regions and what are the possibilities if certain indicators and scenarios around the world and COVID-19 in relation to the SDGs are not investigated and kept in mind. So that was one that I thought was very intriguing. And again, I just have some screenshots showing and going through some of those tools. Are there any comments or suggestions or anything else that you'd like to think about? Dr. Laurie, you have shared something. What have you shared?
I just shared the link for what you were just.
Oh, yes, absolutely. Thank you.
Yes. And there are a couple questions in the chat that I would like to have you respond to. Yes. And the first is from University of Chile. Very interesting information. Do these websites have permission/authorization to share images and pictures, for example, for classes with students? And this came in early when you were looking at the infographics, I think.
The global burden of disease.
I think the infographics from WHO and the places like that.
WHO and organizations like that definitely will allow you to use those type of sources. These are organizations that want you to use their materials and get the message out and promote. If in doubt, I always encourage you to cite your sources. This is a good practice for you, but it's also a very good practice for you to teach your learners and your trainees. So in that perspective, when we're looking at these are all open data sources. These are made freely available. So they do want these to be shared. The World Health Organization is not keeping a message quiet. They want these messages to go out to all organizations. So any organization connected to the United Nations, with such as the World Health Organization, is definitely going to want that message to get out. And these are learning and training tools. So please do that, but always cite your sources. It's a good practice for you. It's a good practice for your students. And I hope that answers your question. And thank you, colleague from University of Chile. I really appreciate that question. And that is one of the reasons also that my guide is everything there is free or open access, but that doesn't mean that it's not important to cite the sources you are looking at. If you decide to include any global burden of disease data or statistics in a paper, an introduction, or within a discussion, of course, just like any other scholarly material, you will cite that in an appropriate manner. And usually these the websites will provide how you might want to cite that paper. And if you're not sure, you're definitely going to be able to put this into a citation management tool, and then that will also assist you. It's a very good question in regards to citation, in regards to our webinar coming up in January on Zotero. So it's a little moment for me to put in a little advertisement for you to join us in January.
Thank you. And then there's a question from Indonesia, and this came in when you were looking at the Global Burden of Disease website, and it says, can we check for data predictions as well?
I'm just going to go into GBD Compare just directly. I believe there are, I'm going to go into the data visualizations. There is predictive data for some sources. And I just want to go into the project itself to look at some of that. I'm trying to remember where some of those might be. What I'm looking at right now are some of the global burden of disease data information, and I know that there is prediction data. I'm just trying to remember where it is. For instance, I think there's some in financing of global health. So there is predictive data. And it's a very, very good question. I'm going to be absolutely truthful. I'm not absolutely prepared to answer it, but I will be on Canvas. Now, for instance, this is an example of financing of global health. So look at, if you look at this, you can see predictions of financing. So this is one that immediately came into my mind because it's one that I've been investigating as it's a new information. So this is a forecasting information. Again, looking at global burden of disease, when we look at causes of risk, country profiles, there is aspects of forecasting in several of these tools. The only thing that I'm trying to remember is the tool that I showed you, GBD in Compare, does not forecast beyond the year of the data set, 2019. But if we were to look at, that's what we're looking at here. But if we were to look at some of the policy reports or the country profiles, there may be some level of forecasting there. And thank you for the question. And I'm going to be sure to keep track of the tools that do forecast and share that with you. So I appreciate the question.
Yes, thank you. And it looks like we are at time. So
yes.
I want to thank Gurpreet very much for this wonderful, again, introduction and deeper dive into some of the tools that we were exploring at the Summer Institute. We will have another one of these webinars in January, as she said, and thank you very much for joining us. Don't forget to do the evaluation, and that helps us with organizing additional webinars like this, and fill out the information for your certificate of attendance. Thank you very much.
Thank you, and thank you for your time.
Bye now.
Bye.